All right, let's dive into something that is at the absolute heart of occupational therapy, clinical reasoning. Today, we're going to unpack how therapists use these structured models, what we call frames of reference, to make sense of the really complex and wonderful world of client care. So I want you to picture this. A new client comes to you, and they are not just a diagnosis on a piece of paper, right? They are a whole person with a life, a story, with hopes and fears. So the big question is, how on earth do you navigate that? How do you plot a course from where they are right now to where they dream of being?
Well, like with any journey, you can't just start driving blind. You need a map. We have to understand the landscape we're working in, which is exactly why having a structured approach is so essential. Without one, you're pretty much just guessing.
And that, Matt, well, that's what we call clinical reasoning. It's the core thinking process OTs use to figure everything out. It's how they understand what a client really needs, how they decide on a plan of action, and then, this is crucial, how they look back and ask, hey, did that actually work? You can really think of it as the therapist's own internal GPS. And listen, this isn't just some fancy term from a textbook. This stuff is vital. It's what allows a therapist to justify their actions, to explain the why behind what they do. It makes sure care is smart and responsible. And maybe the biggest thing of all, it equips them to handle the beautiful messiness of the real world. Because let's be honest, clients never, ever fit neatly into a textbook description.
So what does this map actually look like in practice? Well, one of the most powerful models out there is called Fleming's three-track mind. It's a fantastic way to break down all the different layers of thought that are swirling around in a therapist's head at any given moment.
Yep, 3. That's the magic number. Fleming's model says this whole complex process boils down to 3 distinct tracks of thought. Now, they're separate, but they are also totally interconnected, and a great therapist is constantly and seamlessly weaving between them. Let's take a look.
Okay, so here's a quick look at the 3 tracks. First up, you've got procedural reasoning. Think of this as the vehicle's manual. It's all the technical, nitty-gritty stuff about the disability and the treatment. Then there's interactive reasoning. This is all about listening to the passenger's voice, really seeing the client as a person. And finally, conditional reasoning. This is where you become the expert driver, putting it all together to see the whole journey ahead.
All right, let's dive into that first track, procedural reasoning. This is the technical side of things, the nuts and bolts, really the how-to of the profession.
And this is exactly where those frames of reference, or FORs, we mentioned earlier come into play. An FOR is basically the vehicle's official instruction manual. It's a theoretical guide that gives you the how-to for assessing a problem and then lays out a step-by-step plan for how to treat it.
So the kind of thinking happening here is very systematic. A therapist is asking themselves, okay, what's the diagnosis? What does my manual, my frame of reference say is the standard protocol for this condition? What are the typical interventions to use here? It's all very focused on the problem and its solution.
But here's the thing, right? A client is not a car. They're not a machine to be fixed. So once you understand the mechanics, you have to shift gears into the second track, interactive reasoning. This is where we move from the machine to the person sitting right beside us. This track is all about one thing: listening to the passenger's voice. The focus completely shifts from the diagnosis to the client's point of view. What destination do they want to reach? What are they worried about? This is what tells you if that technical manual you chose is even the right one for this person's trip. You see how the questions are fundamentally different now? It's no longer just about the protocol. It's about the individual. The whole goal here is to make sure that the treatment plan you came up with isn't just technically correct, but that it's actually meaningful and tailor-made for this specific person.
Okay, so we have the manual, and we've listened to the passenger. Now we get to the most complex and nuanced track, where true expertise really shines. This is conditional reasoning, where the therapist brings everything together into one big, holistic vision.
This is the expert driver. They've read the manual, that's procedural reasoning. They've listened to their passenger, that's interactive reasoning. And now they're scanning the road ahead, considering the context, the traffic, the weather, to imagine the entire future journey.
This is where a therapist thinks about that bigger picture. It's about knowing when to blend different frames of reference, maybe a biomechanical FOR for physical recovery and a cognitive behavioral one for motivation. It's about creating a completely customized plan that addresses the client's whole life and their potential future.
So that all sounds great, but how does a novice therapist learn to become that expert driver? It doesn't happen by accident, that's for sure. It takes deliberate practice and some very specific strategies to cultivate these reasoning skills.
To learn this, clinical educators basically act like driving instructors. First, they model their own thinking process out loud in real time. Next, they use targeted questions before and after a session to get the student to reflect. And finally, they might use techniques like thought mapping to visually lay out the logic behind every single clinical decision.
The whole point of all these strategies is to get past just the what, the intervention, and to expose the why. Why did you choose that action? What was the reasoning that led you to that decision? It's all about making that invisible thinking process visible.
And that brings us to our destination. Because when a therapist masters these 3 tracks, they don't just become a practitioner, they become an expert navigator.
And it all comes together in this beautiful formula. The expert driver seamlessly integrates the technical knowledge from the manual, the personal goals of the passenger, and a deep understanding of the road conditions ahead. They aren't just following steps, they are co-creating a journey with their client.
Ultimately, clinical reasoning isn't a skill you learn once and you're just done. It's not a destination. It's a continuous journey of learning, reflecting, and adapting. So the real question is, for every therapist and student out there, where will that journey take you next?